Okay, so hi, welcome to our session on aEQUIP and QI tools. I'm Elise Palmer, Improvement Advisor, and my colleague Karen Jenkins, also an Improvement Advisor, will be taking you through the session today. So in terms of the session learning outcomes, in this session, we're going to provide an overview of the aEQUIP programme, NHS Lanarkshire's virtual quality improvement programme that we run. We're going to explain what quality improvement is, take you through the model for improvement, which is the model which we use within NHS Lanarkshire for any improvement work, discuss project charters, and we're going to hopefully explain some useful tools to help you understand your system and carry out your QI project. So what is aEQUIP? aEQUIP stands for Achieving Excellence in Quality Improvement Programme. The course is an introduction to QI theory, methods, tools and techniques. And on the course, you would learn about practicing QI methods, which would enable you to move from an idea for an area which you believe could be improved through the stages of the improvement journey to be able to then implement and evaluate your change ideas and to be able to sustain any improvements. So that it's just the way that you then do things and it embeds into your normal everyday practice, any of the improvement that you've made. aEQUIP's an appropriate programme for anyone with an interest in learning about quality improvement. It's a practical course, so we do ask that you bring along a project idea in order for you to then to aid and to apply your learning. There's 4 two-hour sessions, which we ask that everyone joins the course and attends these four sessions. And we also ask that you allow yourself time to then be able to apply the learning with homework following each of the sessions. This course is a virtual course and it's delivered in Teams and it covers the following topics. So we look at creating the conditions, what is quality improvement, the model for improvement, aim statements, driver diagrams, measurement for improvement, understanding your system, understanding variation, run charts and PDSA cycles. So we and the course encourage some self-directed learning as well as the teaching sessions. And we also signpost you to further reading. And we also asked as part of the programme that you reflect on your learning and how that relates to your own experience and your project that you're working on. And also suggest that it's a really good idea to keep a learning journal. So just to look at the 4 cohorts that we have running for this year. So we have cohorts 14, 15, 16 and 17 are scheduled for the rest of 2023. Now cohort 14 is now full, but you can register for the additional 3 cohorts and the dates are on the screen. If you want to join any of the cohorts, you can use the link or the QR code to apply via a registration form. And if you've got any queries, you can email us at lqa.qitraining@lanarkshire.scot.nhs.uk. The learning outcomes that we cover in the aEQUIP programme. So we, on the completion of this programme, we hope you are able to explain what quality improvement is and why it's important, describe commonly used improvement science concepts and tools for understanding your system, developing aims, changes and measures and reporting improvements. Gain experience in practically applying key quality improvement concepts to a small improvement project and develop the confidence to apply concepts and tools to contribute to team improvement initiatives. So the programme uses a very blended approach to learning and it focuses on that practical application of the appropriate theory, tools and methods, and practicing is absolutely key. In order to successfully complete the programme, we asked everyone to attend and participate in all 4 online learning sessions, complete any homework and activities in order to help consolidate your theory and practice and your learning, contribute to classroom discussions and breakout activities, feedback to the cohort on your experiences from your homework activities, and complete a programme evaluation in order to provide feedback so that it informs the design and delivery of our future aEQUIP sessions. So what is quality improvement and what does quality improvement mean to you? Quality improvement is defined as the application of a systematic approach that uses specific techniques to improve quality. And quality improvement is not new, and there are many definitions of what it actually is. But this definition is the most useful definition used by the Health Foundation in terms of our approach to improvement within Scotland. So what potentially we think improvement was? What do you think improvement was? So this sketch is created by Sonia Sparkles, and she does fantastic sketch notes, which you can find online, and we have a link at the end of this session, so you can get her Twitter account. So often we think improvement is full of complex tools and terminology, something only experts can do, something seniors need to approve for us to be able to carry improvement out, time-consuming, demanding, failures and wasted effort, and it needs a lot of training and studying. Actually, what is improvement? Improvement actually is a really simple and effective process that everyone has ideas and can improve, inspire and believe in yourself making the change, and start small, test it out, do what's manageable. It's an opportunity to learn new things and experiment, and you've likely done improvement before, you just didn't recognise it. So it's something that everybody can participate in. So I'm just going to talk you through the 8 steps for change, which was developed by Dr. John Cotter. So Dr. John Cotter developed an 8-stage process for leading change. It's recognised internationally as a key model for leading change in different types of organisations. And it's known, as I mentioned, as the Cotter's enhanced 8-step model. So just to talk through each of the 8 steps. So there are principles at the heart of any change, and that's what this model helps to describe. And we need to use that why to connect people. So thinking about step 1, creating a sense of urgency. So your leaders must describe that there's an opportunity that's going to appeal to individuals, the heads and the hearts, and use that statement to raise a large urgency, an urgent group of volunteers. Use that urgency to bring people together, align them and clarify where to direct the energy. A really good example of creating a sense of urgency has been around the recent NHS Lanarkshire flow. And hospitals were full, there was long waits in AD, the flow was not great through the hospitals and into community, and patients couldn't get out of ED, they couldn't get into ED. And that is the why. We needed to understand the why and create that sense of urgency so that then people were keen to be involved. Step 2 is forming and building a guiding coalition. So we want to convince people that change is necessary. And this is a diverse team in terms of level, function, location, roles, ideas. We need a team to be able and willing to work across hierarchy, levels, functions with respect and energy. And we also want a team that's committed to change. And a very good example, again, in terms of Operation Flow, was the Flow teams actually engaging staff across the sites and areas and the number of staff that were involved with that. Looking at the 3rd step is forming a strategic vision. So Dr. Cotter defines strategic initiatives as targeted and coordinated, and that if we design and execute them fast and well, then that will make your vision a reality. And again, with delivering Flow project, it was a project to free beds in the acute hospitals, and the vision was communicated regularly on a weekly basis via videos, visits to sites, etc. Step 4 in the steps for change is enlisting a volunteer army. There are steps for this, so we want to give people a reason and motivation to join the movement. Use your vision for this. So get just enough people involved, recognise the effort of existing volunteers to keep them engaged, and maybe recruit more individuals to keep that interest. And also show gratitude and appreciation for those that are involved in the project along the way. And again, as Operation Flow, we asked for volunteers on site, and it made it easy for people to feel that they could help with this. Thinking about step 5, so enabling action by removing barriers. So by removing barriers or inefficient processes, leaders can then provide the freedom and the freedom that's necessary for employees to make changes and fix problems that have arisen. So look out for statements like, well, it's not done that way, or we've tried that before. And often these can be the hidden barriers. The NHS has a lot of bureaucracy, and we want to give permission to test different ideas and bring decision makers together for quick resolution of problems. Step 6 is generating short-term wins. So wins must be collected and categorised and communicated, and that's really important. We want to do that early and often so that we can track progress and we can energise volunteers so we can drive the change. A win is small, is big, it's anything that helps you move towards your goal. It's relevant to others. It could be actions that you've taken, a lesson learned, processes improved, or new behaviours that have been demonstrated. Step 7 is sustaining acceleration. So the idea here is that you continue trying hard to make change after the initial successes. So you don't just stop. Changes have started. You want to keep going to improve the systems, the structures, and the policies that you're working on. And people are getting used to change. So that's your key opportunity to keep moving, keep going. Some key tips there is just around revisiting the urgency after you've generated your wins so that you keep the goal in mind, you get more people involved with new people, new fresh eyes, you'll likely then find more barriers to improve. And step 8 is instituting change. So to ensure new behaviours are continued, it's important to define and communicate the connections between the behaviours and the success of the project, and that helps to create a cultural shift. So steps 1 to 7 of this model are about really building new behaviours, new ways of working, and that step 8, institute change, is about the sustaining the new ways and embedding new practices. So now we've talked you through those 8 stages, I'm just going to touch and introduce you to the model for improvement. And this is the quality improvement model that we use and teach within Lanarkshire. So the model for improvement is split into 2 parts. The first part is the 3 questions which you'll see at the top there. This is the thinking part. And the second part is the doing part. And all of your 3 questions are underpinned by Plan, Do, Study, Act, PDSA. So the 3 questions at the top of the model, these are interwoven, and although they don't need necessarily answering in order, they do all need to be answered before then you move on to PDSA. So let's look at the questions in a little bit more detail. It's useful to think about the following questions in order to answer the thinking part of the model for improvement. So the initial question of what are we trying to accomplish? This can also be read as how much by when. And this is the aim of your project. What are you aiming to achieve? You will need to understand your problem so you can then set an aim statement. The second question, how will we know that change is an improvement? This can be read as our measures section, and we want to know if the project is reaching its aim. The third question is, what changes can we make that will result in an improvement? And you'll have ideas about changes that you can make that's going to lead to improvement. And this is your theory for change. So now we've touched on the model for improvement. I'm just going to quickly touch on project charters. So for any improvement project, we would encourage and recommend you to complete a project charter. The charter asks key questions to help you understand your system, the area you're working within, and encourages you to be able to answer each of the 3 questions from the model for improvement. So thinking about your aim, thinking about your measures, thinking about your change ideas. A project charter is used to provide direction and a sense of purpose to improvement projects. It defines what the aim of the project is, and it clearly outlines what the project hopes to achieve. It communicates what the aim is, why it's important, who is going to be involved in your project, the measures being used, the methods being used, and your project timescales. And the project charter can be accessed on the NHS QI zone, which again we'll provide a link for at the end of this session. And I'm just going to pass over to my colleague Karen now.
Hi, I'm Karen Jenkins, Improvement Advisor, and I'm going to talk you through understanding your system and using technical tools. So there's various quality improvement tools, and we're going to talk about the cause and effect, the force field analysis, some surveys, process mapping and Pareto. But first of all, you need to know about what is a system, because all projects happen in a system. So here we've got the circulatory system, and we've also got the Glasgow train system. So in a system, you've got an interdependent group of items, people and processes that work together towards a common aim. So the human body works as a system, and there you've got the circulatory system within it that's working together to keep us healthy and alive. So it's going towards a common goal. The Glasgow trains are a complex system, and for them to work, you've got a number of items, job roles, processes that have to work together to run smoothly so we can get from A to B. So a system is an interdependent group of items, people, and processes working together towards a common aim. And some examples you might think of in your area might be your treatment room or a ward within a hospital. There are many different sizes of systems. So that's a great quote from Paul. Every system is perfectly designed to achieve exactly the results it gets. So everything's set up to do what it gives. So if we always do what we have always done, we'll always get what we've always got. So you have to put changes in to make the outcome different. Now here's the quality improvement journey and understanding your systems. Elise has talked about creating conditions, which is the first part, and understanding your systems, which I'm going to talk about together, but I'll just briefly take you through this. And this is available through the NES TURAS site as well. You can get videos and information about everything that's talked about here. So there's also developing aims in your change theory, how to test changes, implementation, spread. And these are all wrapped around with leadership and teams, project management and communication, and measurement that are central to all your projects. So I'm going to focus on some QI tools. So here's some core improvement tools that will help you understand your system or work out what to do next. And here are the quality improvement tools we're going to talk about. And I'm going to start with feedback, so surveys. So with surveys, you're getting an understanding of your system by capturing the views of patients and staff. So you're understanding attitudes, behaviours, perceptions, so you're getting a different take on the system. And these can help determine what improvements should be tested. So you're getting feedback from the users of your system. We've got a couple of samples here of different surveys. So here is a treatment room staff survey. So in this survey, you've got a Likert scale of 1 to 5. So you're asking views on how comfortable are you within your role. And then we've also got yes and no answers. So there's lots of different ways you can ask, and you can also have like a general comment section if you just want to gather a bit of information. And other adaptations could be smiley faces, which are used quite often now. So really you're gathering a bit of information from here. This is the staff within your system. Right, on to process mapping. So this is an absolute favourite tool that's really good to use. So this is often used to map a journey or a pathway with the people who work within that system. So one of the key points is to define where you're starting your journey. So you've got your journey that you're looking at within your project. So you have to define the start. Otherwise, people will talk about all other parts. You need to define the start and the end of your process. So you can use a process map to map the whole journey or just a part of it. And you need the people there from a whole range of roles, and you could have patients carers as well. And what this will do is help the team understand where the problems are and identify areas for improvement. So some steps may be very clear and very simple, But other steps, if they involve a lot of decisions and changes, then that could be an area to focus on. So we've got here an example of a process map, and the kind of squashed circle at the start, that's your start. So that's about referral to social work. And then you've got a similar shape at the end with discharge. And then the kind of rectangles in between are different steps in the process. And then your the kind of decision one here, she's got record, but that's a decision shape. So in your process map, you can use the different shapes to define whether it's decisions or different stages. And I think there's also icons for, if it's a certain documents that used, or if there's different processes. And then you can use arrows between them to say what's happening. It's also good, you might want to add in like timescales so that you can get an idea of how long something's taking. So a fishbone diagram, and this is also called a cause and effect. So this is often used to, if you've got a problem. So here we've got here weight loss required. So you put your problem on one side, and then you think of everything that feeds into this problem. And often you might just start with a load of post-its and you work out what the themes are. So for this one of weight loss required, there's a theme here of diet. So you write all the things about diet. For example, no portion control, unhealthy food choices, etc. And then you think about the processes. So it's another, themes about processes, and that's like not preparing. There's no process preparing meals. So you're just eating snacks all the time. You've not got a good exercise schedule and things like that. So think about the processes. Behaviours will be a big thing with the weight loss required. So think about it's your behaviours and habits really, and that in a work system, habits and routines can come into play that you're wanting to really look at. So with this one, eating late at night, eating out when they're out a lot with friends, their behaviours that all lead to there being an issue with weight loss. We've also got here, you can put in people would be a theme, and motivation as well. So every kind of problem can be analysed and you can work out. And what you would do with your, you would pick one of these ideas and run a sort of test of change, or think, right, I'm going to change that one and see if it actually causes weight loss. When you're running it with a group, you really want to grab everyone's ideas so that you're getting the best possible solutions and change ideas. So it's a great way to to let everyone put down what they think is going on and have it in a one-page picture. So now we're on to Pareto. And this is a very useful tool. If you've done a survey, then you can plot your survey results on a Pareto. So rather than you picking a change idea which relates to like my favourite thing that I really want to change, because you're putting the results of your survey in, what you're finding out is the biggest problem that's talked about is missed planned exercise, because you've put your survey results in order of size. So the one that's most frequently written is misplanned exercise. So you've got that happening 36% of the time. And then you can say, well, my next biggest area is did not plan meals. So as it said, the most common events are on the left, going to the right. So what you're wanting to do is use your 80-20 rule of focusing your most of your energies on the things that cause the problems most of the time. And that can help save you a lot of time. And the way it works is there's a cumulative frequency line that goes up. So as you work from left to right, you're going from 36% here up to 100. And when you're at 100%, that's all the reasons for being unhealthy being put together. So you're identifying the vital few, so the factors that warrant the most attention. So the next, we've got an example of, yes, okay, and it helps the team identify where to focus their work. So here we've got an example of a Pareto chart for a real project that was done about prescribing errors. So on the left, we can see the greatest error that was happening was duplicate dose. So because they found these results out in the data, then they could focus their energies on looking at duplicate doses being given. The wrong patient being given a medication was one of the smallest errors, so that wasn't something to focus on, rather focus on duplicate dose or incorrect. I think that says incorrect drug being given. So it really helps you identify where to focus your energy. So force field analysis is possibly something that you would use if you had a change idea and you were thinking, I'm not sure how everyone feels about this change idea. So you've got the present state and you want to move to your desired state. And what you would do is write down with your team all the list the reasons for and against the change. So the reasons, so you've got forces for the change, so you'd list them and you can actually change the weight of the arrow to say if that's a really strong force for change or a weaker force for change. And then you've got your forces against change. And again, you can note which ones are stronger, which ones are weaker. And by looking at this as a group, you can then develop strategies to reduce any forces against and strengthen forces for the change. So you can, if you've got all your forces for change, you can think, right, I'm going to make that one stronger. Maybe I'll do communicate at a meeting about this change idea. So that would give you a bit of a focus. And the ones against, you might think, well, I need to just speak to this person about that change and, persuade them that it's a good idea. So it really helps give you a good strategy. And it's useful when you want to overcome resistance to change. So that's a great little change idea. So in summary, the feedback, and you've got feedback and surveys, so they can be used to gather information from people, whether that's patients, carers or staff. You've got process mapping, which enables you to visualize the process so you can see what happens in a process from the angles of different staff groups, patients, carers as well. And we've talked about the fishbone, so you can collect and organise current knowledge about potential causes of a problem. So you can look in detail about what's causing a problem, like something not happening. And a Pareto is a great tool to focus on areas, to get a focus on areas of improvement with the highest impact. Force field analysis, that's summarising your forces supporting or going against a change. So it enables you to form a strategy for a change to happen. So online, so there's lots of information now available on the NESS QI Learning Zone. So really would say have a go and look at that. And there's like short bite-sized videos of 2 or 3 minutes about each part of the quality improvement journey. There's also a data and measurement framework, and that's in NHS Lanarkshire, and that will be available on Firstport. There's also quality improvement training that you can do that NESS organise. So there's a QI fellowship, the Scottish Improvement Leaders course, SCLIP, that's Scottish, that's Leaders, Coaching and Improvement course. On Twitter, as Elise mentioned, you can see Sonia Sparkles, Amy Edmondson talks about psychological safety, Helen Bevan tweets loads of things, so you get some amazing resources there. And the QI community is something you can join, and they have events as well. And we've got our aEQUIP, which you can see below the flyer, and there's a QR scan. You can scan below to join one of our cohorts from August onwards. So thank you for listening today, and please get in touch if you have any questions.